2 of cholestasis of pregnancy. First video, I talked about what cholestasis is and the presentation. Today, we're gonna talk about how we diagnose cholestasis of pregnancy and then what treatment options are. The diagnosis of cholestasis is made by blood work. Let's say I have a patient that comes to see me, she's in her 3rd trimester, and she says, Dr. Ali, I have had this unrelenting itching on my hands and my feet. It's usually worse at night. It keeps me up at night. I just can't seem to stop scratching. Already, as an OBGYN in my mind, a little light bulb goes off and I'm like, this patient probably has cholestasis. So how do I diagnose her officially? It's gonna be by blood work. Things that we look for are the levels of bile acids, and we look at liver function tests because, again, this is a condition of the liver. One of the things that can be pretty frustrating is that sometimes it can take up to 7 days to get back the results of the bile acids. But because my patient is coming to me with her symptoms and her frustration, she's clinically presenting like cholestasis, so I'm going to treat her like she has cholestasis. Most important thing that we have to do with patients with cholestasis is increase the monitoring of the mom and the baby. Why do we need increased monitoring? Is because we know that patients with cholestasis are at an increased risk of preterm birth and, unfortunately, of stillbirth. That's not something anyone wants. What does this monitoring look like? This is called antenatal testing. And with this antenatal testing, we're going to do weekly ultrasounds, and we're also going to do NSTs, or non-stress tests, where you wear those bands, one over the baby's heart rate and one to look at your uterine contractions. Those give us a ton of information about the well-being of your baby. Another super important thing, it is a standard of care for us as OBGYNs to educate patients on fetal kick counts and fetal movement. Now, with patients with cholestasis, you want your patient to be extra aware of fetal movements. If your baby's movements are off, feel different, something changed, it's not their usual routine, they're slowing down, you need to vocalize all of these things to your provider. Again, because there's that increase of stillbirth with cholestasis. So again, we're gonna increase the number of ultrasounds we do, and we're going to increase the monitoring of your baby. Another treatment option are gonna be with medications, and this is gonna help to alleviate your itching symptoms, because trust me, I've had these patients and they are just besides themselves. Like, even if you've had it, you know someone, you know that the itching, it's hard and it's very bothersome.